Your name?
Heinz Rothgang.
And in which city and country are you based?
Germany, in the city of Bremen.
And what organization do you work for?
I work for the University of Bremen, the Center for Social Policy in particular.
Great. And how would you explain what you do in simple terms?
I'm a professor of health economics, so I'm teaching and researching.
Okay. And what do you research? Which areas?
Long-term care is one of the major areas, and also healthcare systems, comparative healthcare systems, and health policy.
Okay. And what is commonly understood as a long-term care in Germany? How would you describe it? What's in, what's out?
In Germany, we had a long-term care insurance introduced in 1994, and that very much sets the place on what we think of long-term care. So long-term care is what's provided by the long-term care insurance. So that's the way we think about it. And what is it? It's money for families that do informal care. It's services for home care, and it's nursing home services. So that's the major benefit you get from long-term care insurance.
Okay, great. And what would you say are the main 3 policy priorities for long-term care in Germany at the moment?
In the moment, we have a discussion about financing, as we have had for a couple of years. We discussed the quality issue, that's also very prominent, and we discussed the entitlement that goes under the heading of what's the definition of long-term care. We think that our definition is too tight and that we should have a broader definition.
Okay, okay. To what extent have these priorities changed over the last maybe 5 or 10 years?
I think they are much more or less the same than they have been before. So
okay. And what about the next 10 years?
I'm quite sure we'll talk about financing. We will talk about quality. I hope that we have managed a new definition of long-term care within the next couple of years so that we don't talk about that any longer.
Okay, okay. So, is the current financial crisis, do you get a sense that this current financial crisis is having an impact on the long-term care system in Germany?
Up to now, I would say it had no impact. One reason is that the financial crisis has not hit Germany as hard as it has hit other European countries. The other thing is we have an insurance-based system, so if we talk about tax base or crisis in the tax base, we are not affected. And so that's why I think, no, it's not a major concern.
Okay. If you had the opportunity to introduce one new policy reform, what would it be and why?
I think the single most important policy reform I would introduce is that we had an adjustment mechanism for the benefits in long-term care insurance, because at the moment those benefits are given in numbers, in euros, and if we don't do anything about it, the purchasing power is declining. And the situation we had for 15 years, they were not adjusted for inflation or anything. Then we had 3 ad hoc adjustments, and I would want to get rid of this discussion and say we had a mechanism where on a regular basis these benefits are adjusted, taken into account the development of wages and prices, and then have a formula, and then we are done.
Okay. And what's the likelihood of that happening?
Fairly low, I would say.
Okay, okay. So in your view, what's the most important piece of either policy or research evidence that we need in order to address or inform policy changes in Germany?
That's a tricky one. The single most important evidence
that would move things forward?
I think we don't need evidence. If I refer to the areas I've mentioned before for financing, we know almost everything, we just have to act. The definition of long-term care, we have had a commission that reported in 2009, so we know a lot about that. So generally speaking, it's not a question of information that we are lacking. What we are lacking is a determination to put some policy through.
Okay, interesting. The next few questions will be quickfire. Give me a scale rating between 1 and 10.
Mm-hmm.
So, What policy priority is allocated to long-term care in Germany?
3.
How aware is the general public of what the long-term care system offers to people in need of care?
7.
7. And how well does the system support people with long-term care needs?
8.
Okay. And how well does the system support the needs of carers?
5.
How integrated are health and social care services or policies in your country?
3.
Got it. Thanks very much, Heinz.